Hello there, MilkmanAl here. I wanted to discuss the recent controversial decision that the USMLE made to make Step 1 a purely pass-fail test. So, as most of you watching this probably already know, Step 1 has historically been the most important exam that potentially any medical professional takes in their whole career. It's the most influential exam in terms of residency selection, and basically the primary metric of how qualified you are to go into residency. So, as you might imagine, making this exam purely pass fail instead of a scored exam has some pretty widespread implications. During a recent Ask Me Anything session with the Student Doctor Network, I was asked about my thoughts in the USMLE, so I thought that I would edit that video up and give you guys a chance to see what I thought about this controversial move and what I thought the offshoots and outcomes of it are going to be. So before we jump right into the video, if you like this content, if you find this useful, please drop me a like and a subscription here. That would be really appreciated. You can also follow me live on Twitch about 3 nights a week from 8 to 10 p.m. I have a policy where I am open to any medical question at any time. It's always a medical AMA on my channel. So if you have any questions, come on by. Ask me anything you want. I'm MilkmanAl. Thanks for watching. Enjoy the video. Oh, step 1 going pass fail. Yeah, so that in my opinion is a very short-sighted move. Because there has to be, like you say, there has to be some metric to set people apart, right? Like, so the obvious choice is step 2, right? So people are going to like accelerate their taking of step 2, and that will just be the new step 1. I mean, that's the most obvious conclusion that I can see. Like, because, you know, if somebody gets an A in their internal medicine rotation at University of Arkansas versus somebody who gets an A at UCLA, or somebody gets an A at Florida, like, what the hell does that mean? You know, how do those people compare? That doesn't mean anything. Like, they all got A's, but what, you know, did one person, like, sleepwalk through their rotation? Did another one, like, you know, actively put, like, central lines and chest tubes in every single person that they came across and, like, rock it out? You know, who knows? Who knows? There's no way to determine that, you know, other than maybe, like, rec letters or something, but there has to be something. There has to be some objective measure to differentiate people, you know, that has enough granularity to, like, make a difference. You know, so, like, if you just do letter grades, like, A, B, C, D doesn't tell you anything. You know, because, like, what does an A versus another A mean? That's just crap. But, you know, when you have a test that's scored, you know, over several hundred points, or I guess it's really only over, like, 200 or 150 or something, right? But yeah, when you have 150 points, that starts to mean something a little bit more, right? You get a better spread of data. Like, you can start drawing some, like, reasonable conclusions from those data about, like, you know, where people fall in terms of their, like, academic performance. And then you can filter in all of these, like, intangible things. Like, you know, yeah, grades matter. Sure. Yeah, grades matter. Rec letters, you know, the interview, things like that. But you can't just, like, straight up interview people and just, like, you know, do the, that one to, like, interview people. That doesn't make any sense. Like, presumably, a lot of the people who wind up here just simply aren't qualified to do one of these things. And that's okay. Like, we're not all the same, and that's fine. You know, it's okay to apply to something and not get into it. Like, these are, like, very competitive people, and these are ultra competitive people. These are very successful people, and these are ludicrously successful people, right? Most med schools have pass-fail in the first 2 years. Yeah. I mean, I think that is fine, because there's so many different ways to do the clinical years these days. You know, whether it's 1 year, 1.5 years, you know, there's systems-based, there's, like, subject-based, there's problem-based learning, there's all sorts of different stuff. So, like, you know, you run into the situation where, like, the grades are kind of meaningless. Again, just like rotations. Like, if you, so I don't know if you're aware, but they have a like at the end of each of your specialty rotations, they have a test called the shelf, which is basically a NBME test that's like basically step material, like step 2 material, but like specialized for that rotation. Like, so it's focused on that specialty. And you get scored and like, you know, statistically measured. Yeah, so like that's an objective way to measure yourself against other students, you know, and like having that factor in heavily to your grade, or at least like reported in your transcript, I think would be useful. I don't see it. I don't see how you could, you know, have a specialty split into so many different, or have a career path split into so many different specialties that are so vastly different and have no objective way of differentiating the people wanting to go into them. I just don't get it. I don't see how that's possible. Because there are, again, are people with like differential competencies. You know, you don't want somebody at the bottom of your class doing your brain surgery, right? Let's just be real. Let's be real here. You want the most qualified, hardcore, dedicated person to be in there chopping up neurons. And without objective measures, you're not necessarily going to get that. Let's see, residency directors and competitive residencies are going to become even larger prestige wars. Yeah, probably. I mean, what else are they going to have to go by? How can someone who went to a low-tier MD school compete with someone who went to Harvard if you're applying to something super competitive like ENT? Yes, agree. And that picture gets muddied even further when you consider that schools are different tiers for different specialties, right? So I will continue with Arkansas, because when I went there, you know, it's Arkansas, right? It's Arkansas. Like, nobody wants to go to Arkansas, except if you want to do neurosurgery. And when I was there, Arkansas was like easily a top 5 neurosurgery program, maybe like top 3. I believe that probably has changed, because I think within like a couple of years of me leaving, they had a bunch of like really big name surgeons leave. But anyway, for the sake of discussion, we'll say it's still true. So, like, basically what I'm saying is schools, and KU similarly, KU is a very high-powered neurosurgery institution. You know, and it's in Kansas. Nobody wants to go to Kansas either. But like, you start mixing and matching, you know, so like Harvard isn't always number 1, neither is like USC. And Arkansas is not always at the bottom of the barrel. So then like, you know, you get like all this weirdness, like interspecialty wise, which I guess isn't like that, you know, awful, because each specialty is going to be like so insular that they won't really care about what other specialties are doing. But like for med students, it's super confusing, right? It's like, how do you know which, like, where your program ranks until you're like actually in the middle of it? Because I had no idea. I didn't know that until like one of my friends who was interviewing for a neurosurgery position in my 4th year of residency, or 4th year of med school, came to Arkansas and was like, oh yeah, this is one of the best programs in the country. I was like, WTF, man? Like, how would have I ever known that? So I don't know. I don't know where that's gonna go. I mean, like I said, I think the immediate future is step 2 is going to be your gold standard. But if they make that pass fail, I don't know. I don't know what you do. It's going to be a weird thing. Real weird. I mean, they'll have to come up with something. And, you know, like, I'm not, kind of as I alluded to, we're not all special snowflakes, right? Like, no matter how hard I try, I am never, ever going to be a successful center in the NBA. I'm 5'8", dude, and stocky. Like, there's just no chance. I don't have the ability to do that. And similarly, some of these people, you know, whether they're up here or down here or whatever, don't have the ability to do some of these other things, right? Like, some of these people who are going to be really badass family medicine docs couldn't be a radiologist. They just, like, you know, they could try it. They'd probably be, like, passable, right? Like, I could work on my jump shot, and, you know, be decent at basketball, right? But I would never ever rise to the top. And I feel that's maybe less the case like within medical specialties. You know, these are all, again, very successful, very smart people overall. But Um, sometimes the ability just is not there, and you've got to figure out a way to suss that out. Because we're talking about people's safety here, ultimately. But yeah, I don't know. I think that's gonna do a huge disservice to everything, basically everything healthcare. But I will follow that closely. That's one thing that I'm very interested in seeing, like the fallout from. And it'll take a couple years, like those people have to, like at the very least it's gonna take 2 years. Like those people will have to get through, like actually have to take step 1 and then get through to residency applications. Before we can see what that does. I don't know. It's gonna be a wild ride. Thank you for stopping by. Cheers. I am MilkmanAl. Take it easy. Have a wonderful Wednesday night. I'm out.